How does a CORT scan show Hilar lymphadenopathy for TB? Imagine trying to see tiny structures deep inside the chest that are hidden behind bones and tissues. A computed tomography scan, or CORT scan, helps doctors do just that by providing detailed cross-sectional images of the lungs and surrounding areas. When it comes to tuberculosis, or TB, one of the key signs doctors look for is hilar lymphadenopathy, which means enlarged lymph nodes at the lung hilum. The hilum is the area where the main airways, blood vessels, and nerves enter the lungs. On a CORT scan, enlarged lymph nodes appear as round or oval shapes that are bigger than 1 centimeter in their shortest diameter. This size threshold helps distinguish normal from abnormal. These nodes often lose their normal fatty center, called the fatty hilum, which is usually visible in healthy lymph nodes. Instead, the affected nodes may look denser or more solid because of inflammation or infection. In cases of TB, these lymph nodes often show specific patterns. They tend to be multiple and can be found on both sides of the chest, although the right side is more commonly involved. The nodes usually take up contrast dye evenly, which makes them appear brighter or more prominent on the scan. Sometimes, the centers of these nodes develop areas of necrosis, which means tissue death, and show up as low-density or darker areas inside the nodes. This necrosis is a hallmark feature that suggests TB rather than other causes of lymph node swelling like sarcoidosis or lymphoma. Another important aspect is that TB-related lymphadenopathy often involves several lymph node groups, such as the subcarinal and paratracheal regions, which adds to the confidence in diagnosis. CORT scans are more sensitive than standard chest X-rays because they can detect smaller changes, like subtle nodules or early signs of tissue destruction. This makes CORT especially useful for early detection, monitoring how well treatment is working, and planning further care. In summary, a CORT scan shows hilar lymphadenopathy in TB by revealing enlarged, often bilateral lymph nodes in the hilum area. These nodes are usually round or oval, lack the fatty hilum, and may have homogeneous or faint, ghost-like enhancement after contrast. The presence of necrosis within the nodes and multiple involved areas supports the diagnosis of TB. Overall, CORT provides a detailed view that helps doctors identify and evaluate TB more accurately, guiding effective treatment decisions. If you suspect TB or have concerns about lung health, always consult a healthcare professional for proper testing and diagnosis.